My name is Bruce Shirley. I'm an architect. I've been in Richmond for almost 20-some years, and Claire and I have been married for 10 years. Scouts Honor mountain bike race. It's however many laps you can do in 18 hours. It was last September 19th during the race on my very first lap. I was coming up the final mile and basically fell off the bike direct into cardiac arrest. I guess it took about 7 minutes before they actually got the defibrillator to me, and they used the AED twice, and they brought me back. By then, the paramedics had arrived in an ambulance, and they were hiking down into the woods. So they called in the State Police Medevac. It landed in a field and carted me off to Chippenham Medical. At Chippenham, I was admitted to the ER. They realized I'd gone straight into cardiac arrest, that I did not have a heart attack. They think I probably had some mini heart attacks throughout the summer and just didn't realize it. And I was admitted to, I believe, the cardiac ICU unit. I was in the hospital a week before they actually did the surgery on me.
Mr. Shirley had a really dramatic presentation of his coronary artery disease. He got stabilized here in our coronary care unit after his heart catheterization. He had several very tight blockages. We decided it was best treated with bypass surgery. Dr.
Gazoni recommended that we do the open heart surgery in case there was other issues while they were inside doing the 2 bypasses. And while Dr. Gazoni was in there, he did find a third blockage. All 3 were about 95% blocked, and he performed all 3.
The most common operation we do here is coronary artery bypass surgery, which is commonly referred to as cabbage surgery. This particular case, as far as the conduct of the operation, wasn't particularly different. The more dramatic thing was his presentation and his young age. That's what really stands out in my mind.
It was a shock to us. There was no precursor leading up to it, no warning signs. I thought everything was fine. I knew I had high cholesterol, but I figured I was healthy, eating well, exercising, and everything was fine. Well, it wasn't.
And unfortunately, some people don't have any symptoms preceding their heart attack, and that obviously is a very difficult situation because oftentimes you present sometimes when it's too late.
We had the triple bypass. It went pretty smooth. Dr. Gazoni came in several times the next day checking on me. He was fantastic. He genuinely cared. He answered any question, no matter how small it was, explained everything in detail and made sure we understood what was happening.
Here at Levinson Heart Institute, we have a very collegial working environment where we have many different physicians and providers that have very different perspectives, and we all generally try to come together and come up with the best plan for each and every one of our patients. And so we have a very patient-centered treatment plan for all of our patients.
The staff at Chippenham Hospital, they were just fantastic. The nurses, I mean, I still remember Greg in the ICU and Sonia and Kat, wonderful, wonderful people. And they were really good with helping out with the kids when they came to visit. It's a bit scary to see your dad like that and to take care of them and make sure they were welcome and not make it a scary place. My post-op's been fantastic. I now see a cardiologist who I met through Chippenham Hospital also, and he's fantastic. I'm back on the bike, training smarter, exercising smarter, eating smarter. I'm doing races again and doing pretty well. And the 18-hour race comes up in a month, and we're all signed up and planning to do that. People ask us, have you gotten back to normal? And we don't want to. We're still trying to find that new normal, as we call it. And that's more about family, doing things together and getting out of the house and experiencing life and finding that new normal.